Welcome to the Ultimate Depression Survival Kit, How to Overcome and Master Depression with me, Dr. Moses Simuyemba, and we are on day 12, and this is the second part of how to get the most from professional help. In this part, we focus only on antidepressants. So in the first part of day 12, we covered professional help in terms of different forms of psychotherapy that you can get, as well as electroconvulsive therapy. And we looked at detail in that. This video will focus purely on antidepressants. As we covered in the first video, the reasons why you might think of getting professional help, medication needs is one of those reasons, because you will realize that antidepressants are prescription drugs and you have to get them with a prescription from a professional, a trained doctor. And so they are not over-the-counter drugs. Also, antidepressants have quite a number of side effects, and because they are drugs you take for a long period of time, you need to be more careful with them than drugs you might take for a shorter period of time. That is why professional help is necessary to monitor side effects and other adverse effects that may occur, but also to monitor effectiveness, because we do know that there are a variety of antidepressants out there. Some may not work as well for some people as for others, and so a professional needs to monitor that you're getting the benefits of the drugs as well as minimizing the side effects. Antidepressants treat the symptoms of depression, and there are almost 30 different types currently. Most people with moderate or severe depression benefit from antidepressants, but not everybody does. There are a few people who do not benefit from antidepressants depending on the kind of depression they have. So a person may respond to one antidepressant but not to another, and that is why professional help is necessary to check which drugs you are most responsive to and therefore can benefit from the most. Sometimes it may be necessary to try 2 or more treatments before you find one that works for you, but sometimes it may only take the first drug that the doctor prescribes for you, and that works for you too. The side effects too vary between different treatments and people, but generally all antidepressants work just as well. If it works for you, it will work just as well as any other one. It is important to check your side effects and so on, and it also depends on your current needs. There is a video attached to this page, an expert insight video with Dr. Ravi Paul. So in that video he goes into detail about the different kinds of people and the different kinds of medication they may need, also the side effects of the different medication and how they counter that, or how doctors counter those medications with other medications. So he goes in a lot of detail in that, and I would urge you to watch that video. It is very, very insightful. Due to the side effects, and in order to monitor effectiveness of your treatment, you may need to visit your doctor weekly for the first 2 to 4 weeks in order for them to monitor this. Initial treatment may last 4 to 6 months, normally 6 months, but subsequent treatment depends on the severity and the number of episodes you've had in the past. For more severe or a large number of episodes, you may need to take the antidepressants for up to 5 years, but there's varying periods in between that as well, depending on how many episodes you have had. Antidepressants generally are not addictive, but withdrawal symptoms and stopping or missing doses are common, and I'll cover that in a bit more detail in the coming slides. Do watch the video with Dr. Ravi Paul for more information on length of treatment depending on the episodes you've had, possible side effects, and how to choose the right antidepressants for yourself. In this video, I do not go much into the research around antidepressants, for the reason that all medication to be approved has to go through rigorous processes of several trials, including clinical trials, animal testing, and so on. And generally, we are all familiar with the process it takes to approve a medication for human use. These are very rigorous processes, very strict processes. And unlike things like exercise, diet, yoga, and so on, which are not medication, they do not have to go through such strict procedures, and therefore I presented the evidence for that in quite a bit of detail. With antidepressants, however, because of the process required, one can be very confident that all these medications have gone through a lot of research and they've been approved with the relevant authorities after undergoing such stringent research. So safety and efficacy have been studied in detail in most of these, and that is why most times you find antidepressants are regarded as the comparison treatment, because people know how well they work. It has been proven by research. It has been proven by long use over decades, and therefore any other treatment, be it exercise, be it yoga, be it spices, be it whatever, is always compared to medication in terms of how well it works. So antidepressants are the mainstay of treating depression. Other uses have come up over time, such as using antidepressants for various other things, including bedwetting in children, for instance, including migraine in some cases. So other uses have cropped up as people have used antidepressants and found they have other benefits. And we also know that antidepressants affect brain and neurotransmitters. So we covered this in some other videos, but we'll cover it in a bit more detail here too. As I have mentioned, there are many types of antidepressants, and we cannot cover all of them in this video. What I will cover is the two common types, the SSRIs, which are the selective serotonin reuptake inhibitors, as well as the TCAs or tricyclic antidepressants. These are the most commonly prescribed antidepressants, and therefore we will go through these two types of drugs. Bear in mind that other drugs have similar effects and similar side effects and so on. So from these you get an idea of the range of antidepressants available and what you can expect from them. So let's get into selective serotonin reuptake inhibitors, or SSRIs. These are the most commonly prescribed, and examples include paroxetine, fluoxetine, and citalopram. These increase levels of serotonin in the brain, and we know that serotonin helps to regulate mood. It is a neurotransmitter in the brain that helps to regulate mood. The possible side effects of SSRIs include nausea, headaches, a dry mouth, and problems having sex. The side effects usually improve over time as one continues on the treatment, however. Some SSRIs aren't suitable for children, though, and young people under 18 years of age, because research shows that the risk of self-harm and suicidal behavior may increase if they're taken by under 18s. And therefore, because of this, fluoxetine is the only SSRI that can be prescribed for under 18s, and this needs to be done by a specialist. Moving on quickly to tricyclic antidepressants. These are used to treat moderate to severe depression, and some like imipramine and amitriptyline have been around much longer than SSRIs. They raise the levels of serotonin and noradrenaline in the brain. So unlike SSRIs, they also act on noradrenaline pathways. That's another neurotransmitter in the brain. And both serotonin and noradrenaline have been found to have a role to play in mood in individuals. Generally, tricyclic antidepressants are safe. However, you need to avoid cannabis while taking TCAs, as they can cause the heart to beat rapidly. Possible side effects include dry mouth, blurred vision, constipation, problems passing urine, sweating, feeling lightheaded, and excessive drowsiness, especially the drowsiness. That is a common one. Amitriptyline is the antidepressant I took when I was going through depression. The time I realized I was depressed, I was taking it for my nerve pain. It can also be used to treat nerve pain or neurogenic pain, and that's what I was taking it for when I realized it also greatly improved my mood, and that led me to realize I had been depressed. However, it can cause excessive drowsiness, especially in the initial period of you are taking it, the first week or two. This usually fades away as you take it longer, but it is advisable during those early days not to do dangerous activities, drive machinery, and that kind of thing. Side effects usually ease within 10 days, as I've mentioned, as the body gets acclimatized to the drugs. So let's talk briefly about antidepressant withdrawal symptoms. Now, antidepressants are not addictive in the same way that illegal drugs and cigarettes are. They don't cause your body to be addicted that way. But you may have some withdrawal symptoms on stopping, and this is because they also work on other parts of the body where these neurotransmitters may be found. And so when you withdraw them, they affect those other parts of the body as the neurotransmitter levels in those other parts of the body declines. These include stomach upset, flu-like symptoms, can cause also anxiety and dizziness, vivid dreams at night, and sensations in the body that feel like electric shocks. So these might be some of the side effects you might expect on withdrawal. Now, the side effects of withdrawing from antidepressants are usually mild and last no longer than 1 or 2 weeks generally, but occasionally they can be quite severe, and that is why monitoring by a professional is necessary when you decide to stop antidepressants. These side effects are more likely with medications like paroxetine and venlafaxine. So those are more likely to give you withdrawal symptoms. They occur very soon after stopping the tablets, and thus they are easy to distinguish from symptoms of depression relapse, which occur after a few weeks. So that's how you distinguish between a relapse of depression and withdrawal symptoms, because the withdrawal symptoms occur immediately after stopping or very soon after stopping, whereas relapse occurs much later, because usually these antidepressants persist in your bloodstream and in your brain even after you stop taking. So it takes a couple of weeks for the levels to go down, and that's where you can distinguish it from relapse versus withdrawal symptoms. So this has been just a very broad overview. I cannot cover all the breadth of information about antidepressants. Please watch the video with Dr. Ravi Paul that is on this page for more information. But I hope it helps you to get an idea so that you can discuss the available options with your medical specialist and decide on what best suits you as an individual and your circumstances. Commit to whatever treatment you choose. Go all the way and see lasting results. Don't stop halfway through the 6-month treatment or 2 weeks after when you start feeling better. Commit to the whole length of the treatment in order that you see lasting results and don't have relapses. Remember, though, that professional help is only one side of the equation. A lot depends on you and lifestyle adjustments you make. So the thing is, antidepressants can help, but in long term, to overcome depression, you need to make other changes to your lifestyle. I like to consider them as the initial push you need to get over that hump, that critical hump, to improve how you feel and how you are thinking, so that you can then be able to act on other means to overcome depression. So best to use them with other strategies to overcome depression. As mentioned, results depend a lot on you. Whatever treatment you choose or is recommended, it depends on you, because only you can stick to the treatment that is prescribed for you. Only you can go the full course. Only you can have the motivation to get better. Your doctor, your healthcare professional can only do so much. A lot of it depends on you. And I just want to say, as I end this, that a lot of people feel like taking antidepressants is a sign of giving up, a sign of total defeat, and they feel like they've totally given up on life and lost all ability to survive or do well if they go on antidepressants. I want to reassure you, as we covered in the myths video, that this is just not true. You need antidepressants to help you at certain points as you go through depression. It is not a sign of weakness. I consider it a sign of great strength, actually, to seek this help and get antidepressants, only because of the prevailing thinking that it is a sign of weakness and defeat when you get on antidepressants. So in some cases, for some people, it takes a lot to get on them and to stick to them. But I urge you that it may be a necessary step for you, and one you should not neglect if your depression is moderate or severe. So finally, as usual, go through the exercises, take your time, think through it, see how this applies to you. Remember, writing has power.